who is a member of the House Appropriations Committee, and Kentucky Democratic Congressman John Yarmuth, who is a member, of the House Ways and Means Committee. Congressman, gentlemen, thank you very much for being here. Appreciate it. Congressman Culberson, let me start with you. The House Democrats, they've just introduced a new health care bill, very controversial, basically calling America's Affordable Health Choices Act of 2009. What do you make of it?
Well, it's appropriate that the fiscally liberal majority that introduced this bill yesterday did so on the day that the federal budget deficit for the first time in history exceeded $1 trillion. This fiscally liberal majority has already spent more money in less time than any Congress in the history of the United States, and has really placed the future economic prosperity of the nation at risk because of their spending and because of the tremendous taxes that are now inevitable. And in this health care plan, we're looking at massive tax increases. Congressional Budget Office already estimates a cost of $1 trillion. They've already spent over $2 trillion in the first 6 months of this year. So it's unaffordable. It's something the economy cannot take at a time of recession, and just simply, frankly, a very bad idea that needs to be defeated immediately if we're going to protect this nation's economic prosperity.
Congressman Yarmuth, how do you respond?
Well, what is unsustainable is our current path. If we don't do something right now to reform our healthcare system, we're facing a scenario in which by 2040, healthcare will be 35% of our entire economy. We all know that's unsustainable. What we're proposing is to start acting right now to bring down costs, to bring everybody into the system so that we don't have massive cost shifting. And what we're asking the very wealthiest Americans to do is to give up some of those Bush tax cuts to help pay for the system. Under this provision, somebody who makes $1 million a year will have to pay $9,000. Meanwhile, they've gotten a $45,000 cut for the last 7 years out of the Bush tax cuts. We think that's a small price to pay to ensure every American and to make sure that the employees of those very wealthy people always have an option for affordable health care.
But Congressman Culberson, it appears to me, you tell me, as though this is a situation where the wealthy are going to pay for health care that they're not going to use. And oh, by the way, I'm not even sure you consider them the wealthy, because a lot of the people under this plan would be small business owners.
Absolutely. That is a critical point. Small business owners will be hammered under this legislation. All Americans will pay the price for this massive expansion of government power, requiring all of us to buy health insurance. The federal government has already taken over under this liberal majority the auto industry, the banking industry, the insurance industry. Now this bunch wants to take over the health care industry and run that like they do the post office. It's a disastrous idea, and my friend Mr. Yarmuth needs to remember that the liberal majority has already made sure that the Bush tax cuts will expire in about 18 months. Now, that will be on December 31st, the end of 2010, the largest tax increase in the history of America, which this bunch is now about to saddle on top of that. And I would urge people to look at the brand new Economist magazine. This is the problem. Business in America cannot sustain this liberal majority's regulation, taxation, and litigation. They will crush this economy, and at the same time, we've got to protect that patient-doctor relationship. I don't want a federal bureaucrat between me and my doctor, and we as fiscal conservatives, above all, want to do no harm to the healthcare system and protect that patient-doctor relationship.
Congressman Yarmuth, those are pretty scathing words for the people who have the majority of the vote in this country. How do you respond?
Right, and you know where they come from? They come straight from Frank Luntz's memo, which was about 2 months ago, which basically said, here's what Republicans ought to be saying. Government takeover, don't get in the way of the patient-doctor relationship. What we haven't seen from Republicans is any idea at all for approaching this. It's easy to say no. It's easy to say this is too expensive. But we know, both sides know, that what we're doing now, the current path, is unsustainable, and we have to do something. By the way, the CBO estimated that under the plan that we introduced yesterday, only 3% of the American people would end up in the public option. So why that is government takeover is beyond me. I'd like to hear my friend John talk about that.
Go ahead.
Well, I I have to tell you, Mr. Yarmuth, is that if the liberal majority is going to try to convince the country that only the rich are going to pay for this plan, I got a bridge in Brooklyn I'd like to sell you. We all know, as taxpayers, we're smart enough to know that when a liberal tells us that only the rich are going to pay for this, we hold on to our wallet. That's been true throughout history. This is a $1 trillion health care plan that will be paid for by small business owners who will have to lay people off. They're going to have to make the choice between paying higher taxes or laying someone off. They're going to lay people off. We're going to lose jobs. It's going to cost money to everyone in the economy at a time of recession when we're already bleeding jobs. I love this cover of The Economist as well, which shows Texas thundering while California is going bankrupt.
But Congressman
and that's because we have low taxes.
But let me play devil's advocate here for just a moment. The consensus opinion, though, is that if we allow things like Medicare and Medicaid to continue at the rate that they have cost this country, and, oh, by the way, do nothing about health care reform, which most executives, of course, across this country believe we do need to do something,
right,
we're going to put ourselves in an even more dire fiscal situation. So don't we need to do something? The question is,
absolutely,
what is that something?
Dramatic changes in the tax code to encourage. I'm sorry, John. I had the floor last. Let me pass it to you, but let me just say quickly: fiscal conservatives want to look at tax cuts rather than tax increases to encourage businesses to buy health insurance. And John, please go ahead.
Well, tax cuts, first of all, only basically benefit the rich. Right now, we're talking about family health coverage, which now costs $14,000 a year. It's going to go to $25,000 a year in 7 or 8 years if we don't do something now. It doesn't matter how big a tax break or an allowance that you give moderate income people, they're not going to be able to do it. This is the greatest thing for small business that ever came down the road. I ran a small business. I know how difficult it is to pay premiums for insurance when they go up 20, 30% a year. So what we're trying to do is make an option available, a plan so that competition brings prices down. Small businesses will be able to provide insurance and afford insurance for their employees. And if they can't, then they can go into the marketplace and buy affordable insurance themselves. Right now, those small businesses don't have those options.
All right, gentlemen, we're going to leave it there. I thank you very much. The debate continues. I know it's headed to the House Ways and Means Committee in the next couple of days, gentlemen. Thank you very much. Well, when Hillary Clinton was first